So Professor Phil Banfield joins us here in the Isle of Man. He's making a flying visit today, doing a lot of media interviews, obviously following up on the situation with the doctors' now new pay offer. And it seems that's going to be accepted, I understand, but it's obviously got to still be put to the vote. But what's your view on this whole thing? I mean, let's start there. This to get to the stage when industrial action had to be threatened even.
Well, obviously, it's a great shame that Manx Care hadn't listened about the issues of doctors on the island previously to this. It's been a long time being advertised that doctors on the island are finding that their cost of living has been going up, and the amount that's being paid to them each year has not kept up with inflation at all. And so, this hasn't been about talking about pay rise. This has been about restoring the relative value of pay. So I'm really pleased that Manx Care and the Chief Minister and the Minister of Health and Social Care have seen reason, because no one wants to strike, and this is really a victory for doctors and patients.
Well, we kept hearing there was no more money, and now there is more money. So that's what you have to do, is it, to get that situation, to force their hand?
Well, the amount of money that is spent on health and social care is a political choice. And you need the skills and expertise of the medical workforce. You need not just the resident doctors coming over and training. You need local employed doctors who provide much of the workforce, consultants, specialist doctors, GPs. You need an entire medical workforce. So reaching an agreement that helps all of those has to be a good thing for the Isle of Man.
Well, there was this survey done, and it wasn't good in places, certainly for getting new people to come maybe to the Isle of Man. I think ages ago we did an interview with you actually said that this is not a good place to come to work, which was pretty damning. Have your position changed now on this?
Well, you've had 3 staff surveys in a row showing how poorly the medical workforce has felt treated. That's not a great advert for the Isle of Man. Now, recognising the value of doctors on the Isle of Man is an ideal place to reset the relationship between Manx Care, your politicians, and the medical workforce, and of course the workforce that supports them, because it's not just doctors who have had their pay eroded, it's other workers like nurses, porters, and so the Isle of Man recognising and value the workforce as a whole on the island, and the more of course you can keep on the island, the less money that the Isle of Man puts out to the northwest of England.
So can you now recommend the Isle of Man as a place that your members can work?
Well, I think that it's up to them to recommend it. The feedback that I've had is that they are cautiously more optimistic. We have talked before about the culture on the island and within healthcare. There is a new chair of the board, Professor Wendy Reid. She's in my line of work, an obstetrician and gynaecologist, but well known from Health Education England. And you have a new medical director who's coming from my neck of the woods in North Wales. So it is the time to have culture change. But as you've seen from the exchanges that we've had in the past, the proof of the pudding is in the eating, and what we need is concrete evidence for change of culture rather than words.
Is there a better formula to go forward, like stay with the UK model, for instance, on whatever they get, just make it happen here, plus maybe a bit of a lift for the living on an island, or this different way of doing things here to the UK, is that making things more difficult?
Well, that's an opportunity. Right, you have an opportunity to join things up between general practice and hospitals. You have the opportunity for healthcare to be unified with social care. Fundamentally, you have political decisions to make about how that is funded and what proportion of the money raised by general taxation goes into providing that. And that's a choice for your politicians and the public. If you are taxing at 22%, for example, and the tax rate was higher, there would be more money in the system. So it's a conversation to have with the people and the politicians about what they wish to see provided.
And we've heard so much about Manx Care and its ways of doing things. You already touched on this slightly, but is this a model that you think can work then? That this way in the Isle of Man that's being done by having this people in between the politicians and the actual doctors?
Well, that's much easier to have people who understand the bread and butter of how to provide health and social care running that. In general, politicians do not understand the nitty gritty, but they do understand culture change, and they do understand the need to provide health and social care for an entire population. And really, you've got a very weak public health setup in the Isle of Man at the moment. Now, prevention of disease. There's no looking at obesity, for example, and that may be one thing that Wendy Reid and Manx Care and Chris Stockport may be wanting to look at. But predominantly, this is now about engaging and making sure that the workforce feels valued.
Well,
right? If you value and engage your workforce,
but those surveys
they will
didn't show that,
deliver
did it?
their expertise.
That survey didn't show that.
It does not, and therefore, as I say, Paul, I'll be back next year to see whether that's improved.
And what happens about negotiations from now on? Will this be a yearly thing to have the two sides having a little square off against each other, or do you see better times ahead, more constructive ways of getting a pay rise?
Well, there is always a more constructive way of engaging with the workforce. The recognition of a need to keep salaries competitive in a global market at this point in time, a need to be able to attract doctors to the island so you are not paying more than you need to, either for locums or to export patients to the mainland at high cost, or to import private care here. Right? So that is something that is a continuous discussion. You have a local negotiating committee, which is an interface between doctors and the Manx Care. Having those conversations taking place on a regular basis to look at also the working conditions of doctors. What can be done to help with efficiencies? What can be done to make patient care more effective? Because if it's more effective, it tends to cost less. So, having that unified vision between the profession, Manx Care and the politicians is really part of what will allow the Isle of Man to shape its health and social care that suits the Isle of Man. You shouldn't aspire to be like the NHS in England. There is a lot of things that's wrong with the NHS in England and the other nations. For example, we've seen horrendous ambulance queues. We've seen horrendous situations where patients are being treated in hospital corridors. Forge your own future in the Isle of Man.
Yet the situation with the private part of doing stuff here in the Isle of Man, it's still, I know, it doesn't seem to be there and back. And do you think that there's more to just the pay rise that needs to be sorted out in a better agreement?
But you've always got to decide, who's making a profit. Right? It is better if you're funding something through general taxation for the profit to stay within the economy of the state rather than into private firms. Now that's something that the balance of which you have to discuss as an island, and that therefore you have to decide what are we going to provide, what's not going to be provided.
Well, before we go, obviously if anyone Googles the Isle of Man and as a place to come to work, the Dr. Ranson thing will sit over us for a long time. Is there anything that from the fallout from that, or post it all being cleared up, that is still a worry to you, and how it's dealt with and all that sort of thing, or should we just move on from that now? Well,
the underlying issue of having a system that wants to hear what's wrong.
Right.
wants to hear concerns, wants to hear when mistakes are made, instead of trying to say, no, we're just going to ignore you. That's demoralising for patients, it's demoralising for staff, and it's dangerous. And you have not yet proved to the medical workforce that that culture has changed.
Right. So if you were describing the Isle of Man's NHS, is it still in special measures? Is it still be getting your attention a lot? I mean, how would you describe things?
It's a work in progress.
And you'll be back next year?
Yes, I will.